Welcome to As I See It. I'm your host, Dr. Jeff Kegarise. In this audio podcast series, we aim to focus on patient care, the service you should receive at any doctor's office visit, eye care education, our eyes are a precious sense, how do we protect, correct, and enhance your vision, and things that interest me, because I'm all about having fun and enjoying life. Today we want to focus on what else? Coronavirus, COVID-19. There's a lot of information out there from the media, President Trump, Governor Lee, health officials, but I want to focus on what's really happening in the trenches with providers. To that end, the next few podcasts are going to be conversations with providers, both here in our offices, the outpatient side, in the emergency room, in the hospital setting and ICU, in pediatrics, and if we can swing it, an infectious disease provider. Today we want to focus on one of the most important and timely topics again, which is the COVID-19 scare. And we've been talking with a number of physicians across the country. Today it's our daughter, Christen Kegarise, an emergency room physician at the St. Vincent's ER Group in Indianapolis, Indiana. Christen, thanks for joining us.
No problem.
You're on the front lines of healthcare, and the very first thing we want to tell you is thank you very much for the commitment and the sacrifice you are making on behalf of all of us.
I appreciate that. Thank you.
And I'm wondering, have you been overwhelmed or flooded in the ER with patients coming in saying, I need to be tested for coronavirus?
Actually not. In the past week, I worked at a rural hospital, and we've actually seen probably about 50% less volume than we normally see. And that is because of family physicians and COVID hotlines and drive-through services that have decreased the number of patients actually being sent to the emergency room.
Interesting. So it's where the emergency room pre-coronavirus was kind of a catch-all for, oh, nobody's open, I'm going to go there. It sounds like the public health statement of don't immediately go somewhere, call your physician first, has actually kind of moderated your demand at the ER. Is that right?
Correct. We're expecting, though, an influx of patients in the next couple of weeks. So even though we have less volume, we're continuously planning. I should say my directors, who have done an amazing job, in particular, are planning for the possible surge and keeping the rest of us docs and PAs all involved and with their planning and how we're going to help facilitate this possible surge of COVID patients.
Yeah, and everybody's talking about this surge. That's why we're doing social distancing. I guess this is the epitome of social distancing, isn't it? I'm talking to you in Indianapolis and I'm in Nashville, so I think we're pretty safe that way.
But the best way.
But as we do social distancing, as we practice safe at home, or now here in the state of Tennessee, stay at home, we're also going to get into a phase where we know more people have probably been carriers or infected and will start becoming sick. At least that's what everybody's telling us. Is that starting to happen in middle Indiana? Are you starting to see more corona positive patients?
I would say over the past month, we have seen quite a few COVID patients. While they may not come back positive via the tests, we highly suspect they are COVID positive, and we have seen numerous amounts who are very, very sick, but I would say the majority of the patients we are seeing have mild to moderate symptoms, and those people are being sent home.
Okay, so when they're sent home like that, and let's say somebody is COVID positive, right? That's what we're assuming.
Or presumed to be COVID positive.
Or presumed to be, okay. So interesting point that you made there. Sometimes the test can be negative, but you still presume they might be COVID positive?
Correct.
How does that happen? What is that, just a timing issue?
I think there are multiple factors and something we're continuously looking at, but one could be how the test was performed. If it's not adequately performed, could be a hindrance to getting an adequate result, but also some of the tests are even 60 to 80% truly correct, should we say, and actually giving us accurate results, because a lot of test results are coming back falsely negative, even though we test them multiple times. The third test may ultimately be positive. So ultimately, this is a virus, and if you suspect that somebody is sick, at this point, you just quarantine for 14 days. If you're severe enough, as in you can't catch your breath, you're having severe chest pain, those are the people that we are wanting to see in the emergency room.
Gotcha. So is it 14 days now for basically anybody that you suspect has a virus, or is that only in people that maybe you've tested and they are flu negative? Because we still have the flu going around, don't we?
Correct, absolutely. But again, not everybody is coming to the ER to be tested. So no matter what, even if they're sick, we're telling them stay at home and you must be quarantined for 14 days or be symptom-free for 3 days, whichever of those two is longer.
Okay. So in the people that you have seen or that you know about that may have coronavirus, how long do the symptoms typically last? Is there any, do they last longer than the flu, shorter than the flu, or about the same length of time? Is this a week type of thing?
From what we're understanding and what we're telling patients, it's typically about 2 weeks worth of symptoms.
Wow.
So 5 days, you start to get more viral URI symptoms. And then about 10 days, 8 to 10 days is when we're seeing people get the most severe symptoms.
Okay, so 5 days from the start of symptoms, URI being upper respiratory infection, and 8 to 10 kind of when it peaks in the worst symptoms, the worst people feel, if you will, right? And maybe the high risk phase. Is that the potential when somebody goes, I better leave home and maybe I need to be seen by somebody else?
Correct. But again, nobody is perfect, and as medicine is an art, so nobody's going to follow these exact rules, but this is typically what we're seeing. But
Okay.
Everybody's going to be different.
And
some people have fever, some people don't have fever, some people feel shortness of breath, and then the scary part is some people are asymptomatic completely.
So are you having to admit very many people with respiratory issues?
We're admitting some, but I would say not as many as we anticipated at this time. But again, we're anticipating more. But yes, to answer the question, yes, we are admitting, but I would say the majority are going home, fortunately, at this point.
Okay. So not in kind of this respiratory distress. It's not like you're either healthy or you have severe respiratory distress and you're on a corona floor in the ICU. Is that correct? There's a lot of gray area in between. And so
Correct.
far, without a peak, at least in Middle Indiana, you haven't been overwhelmed in your hospital. Is that correct?
Correct.
Okay. What other complications or other side effects, symptoms are you seeing related to corona? For instance, in particular, are you seeing heart problems? Are you seeing GI problems, people throwing up or having diarrhea?
The anticipated complications, kind of the big two, are people who are very hypoxic but coming in not looking an overt amount of respiratory distress, which makes this virus very scary and very different. But two can be complications with the heart, something called myocarditis or cardiomyopathy. And I personally have not seen any cases of that, but it is something on our radar and what we're testing for if somebody comes in with chest pain.
Okay. How would we know? Let's say we have a parent or a grandparent who's basically quarantined on their own, safe or stay at home. And you mentioned something about hypoxic. We asked them, how's your breathing? Well, it's okay. What are some of the signs we should look for in hypoxic, which is basically low or lack of oxygen, correct? What would somebody at home be saying to us, or would it always be, I'm short of breath?
No, that's the tricky part is even with this virus, they may feel short of breath, but their oxygen will be normal. The big signs of somebody having low oxygen, meaning they're not getting enough oxygen to the brain as well, will be confusion or not able to catch their breath or even say a couple of words. That's when we become most concerned and they need to call EMS.
Okay, and when they get to your place and you're going to see them, Is that when you put that little thing on my finger and it reads an oxygen level of some sort? Is that one of the hypoxia tests, or is that totally different?
Nope, that's the first test. We'll hook you up to a monitor and see what your oxygen level is, and then based on that number, we may put oxygen on you, and then go from there based on what your oxygen levels are.
Okay, what becomes a concerning oxygen level? Like for everybody that might be listening to this, what is normal and what is a concerning, or what's ooh, that's really low?
So normal everyday person should be above 90%. But people who have this virus may be, when we get more concerned is when they're below 90%, but it's not just looking at their oxygen, it's looking at if they're confused, what their heart rate is. There are numerous factors that we look at as physicians to determine what extreme measures we need to take to be able to treat people. So, but from a kind of layperson standpoint, the big number we're looking for is if your oxygen is less than 90%, then we will give you supplemental oxygen in a variety of different ways.
And when you're low on oxygen, Dr. Kegarise, does my heart start to beat faster? Does it beat slower, or any correlation there?
Mm-hmm. It can beat faster.
Okay.
That's your body's way of compensating.
I gotcha.
But again, that can be confounded by people being on different medications as well. So, and it may not increase their heart rate.
Interesting. Very interesting. So when you're providing care, you and the other doctors and the nurses and PAs, how are you being protected right now? Do you do anything different than you normally did when you were providing care in the ER 2 months ago?
Mm-hmm. Every patient we're seeing, whether they have respiratory symptoms, GI symptoms that may be concerning for COVID, we're wearing masks, goggles, surgical caps, gloves, and if we have any concern of getting exposed to more of their secretions, or if we're intubating somebody, putting them on the ventilator, then we're taking more extreme precautions and wearing different type of masks and coverings and gloves, and we're doing a donning on and donning off process to ensure that we're protecting ourselves.
Okay. How are you doing on supplies? We hear, at least we've heard in the last week, a week ago, boy, people were really short on supplies. They gradually seem to be trickling in. Do you feel like your particular hospital has enough supplies for you right now to be able to do this?
Yes. From our standpoint, we had a conference call yesterday with our directors, and we are doing just fine on supplies. I mean, we're trying to be smart with the supplies that we have, so if we can reuse anything, we will. But yes, overall, our directors are doing a fantastic job of making sure that we are prepared and covered, and planning for the future to ensure we have plenty of masks and other supplies to keep myself and my colleagues safe.
You know, I think that that's a great point, because when we talk about minimizing this, quote, surge and the keeping people at home and away so that we have fewer cases, and then also if you have fewer cases, then you're going to have fewer deaths. But part of this is stabilizing that curve so we don't get so many that it overwhelms what we can provide in our healthcare system, right? I mean, if we have the same number of cases, but they're spread out over 2 months rather than 2 weeks, we probably have the ability to be able to provide care without overwhelming the system. And that's a big, big part of why you're seeing people and governors say stay at home, isn't it?
Mm-hmm. That's why they're talking about flattening the curve.
Yeah.
This may prolong the virus over time, but it doesn't overwhelm the resources that we have by flattening the curve. That's the goal of it.
Okay. And then what about at-risk elderly? We hear about this, and if you're elderly or at risk, can you tell me, first of all, elderly is older than me, isn't it?
You're elderly,
because
you're my father.
Oh my gosh. But I've always been elderly to you, right?
Correct.
So anyway, in truth, when you think about elderly, medically, what do you start thinking about? Oh, that's an older person.
I think that's a tough question, because elderly may also be defined by somebody's multiple comorbidities. So it's not just maybe the person's age, but it's also their comorbidities. Are they diabetic? Are they immunocompromised? Or do they have any sort of underlying lung issues that may predispose them to not being able to fight off this virus? So it's not just age, it's multiple comorbidities as well. But the problem with this virus, while it may not be affecting kids as much that we know about at this point, kids are still getting sick. It doesn't matter if you're 20s, 30s, 40s, 50s, 60s, 70s, so on. Anybody can be affected by this virus. So, but we need to protect those in particular who are greater than 60, like you, who we need to protect, and those who are much older, 70s, 80s, which are a lot of our patients who are coming in particular distress and being placed on the ventilators.
And is it just, is that, Christen, just because they're, quote, old, end quote, or is that because older people have a worse immune system or have also are more likely to have lung and heart issues? Or is that kind of
a tough question to answer? I think that at this point, again, they usually have other comorbidities as well, which predisposes them.
Yeah. Okay. So, but if you had somebody that's a really, really healthy 70-year-old, not on any medicine, never had lung problems, asthma, obstructive pulmonary disease, that person actually might be slightly safer than the person who's 52 years old that's diabetic with asthma, right?
Maybe, but then yet there are 40-year-olds, 50-year-olds who are getting it as well with no comorbidity.
Yeah, so that's what makes this a really scary thing. Is it's not just what is, it's what could be, isn't it?
What could be.
Yeah, yeah. What are other, we hear about immunocompromised people, and we think about folks that have cancer that are on cancer treatment, okay, or chemotherapy that may be immunocompromised. But there are other things that are immunocompromising situations, right, that you think about. What do you think about when you think about whether somebody might be presenting as immunocompromised?
Somebody definitely history of cancer, history of cystic fibrosis, history of transplants of any sort. Anybody who's chronically on immunosuppressants or steroids can predispose people to not be able to fight off infections like you or I could.
So that brings up one point. This is a out of left field question. We got weightlifters sometimes that are bulking up on steroids. They're taking certain of those corticosteroid regimens, gonadotropines, and all this type of stuff. Are those people technically a little bit immunocompromised, and are they at a little bit higher risk?
That's a good question, and something I can't tell you right now because I haven't read anything about those patients.
It's a bad thing to be pumping steroids anyway, so it'd be better to just not do that. But weight rooms, for the most part, have closed down because of so much of the virus that becomes from somebody and is placed on a rack or on a table or on something someone else touches, right? And then
Correct.
The new person really gets it from that table, not so much just being around the other person. So it's really a matter of sanitizing your environment, not just yourself. Would you agree?
Correct. That doesn't matter where you are, whether you're at the gym, which hopefully you're not at the gym right now, at the grocery store, washing the shopping cart down, or anything at home, doorknobs or any of that sort, you're washing down as well.
Okay. Very, very good. So, first of all, again, I just want to reiterate how much we appreciate you being on the front lines, helping protect us. Sounds like, at least in your situation right now, we've got the healthcare resources and you have the healthcare protective supplies to be able to take care of the people that you are taking care of. We're all concerned about the potential surge and the need to flatten the curve. And so I think you would agree, stay at home is the right recommendation, but also sanitize any surfaces somebody else might have touched. Is there anything else you want to say to us or recommend to us at this time from your viewpoint as an emergency room physician?
I think I want to thank just the community in general. I know in Indiana and I'm sure in Tennessee, but it's impressive with how how much people are actually listening to recommendations and not rushing to the ER just because it is an anxiety-provoking time, but people are utilizing resources outside of the ER to support their care in other avenues rather than just rushing to the ER, but also how the community itself is coming together to support each other and helping the elderly, bringing them groceries, bringing those who are at high risk, not just the elderly, groceries, those who are sick, but also all the support we've seen in the ER with numerous people bringing us food and just putting signs outside our hospitals, having police drive by, thanking us for the care we provide. So it's while there's a lot of negative, there's a lot of positive going around with this as well.
Yeah, it's a real time for us to think about not just ourselves, but really be thinking about our community, and more than can I minimize getting infected or infecting somebody else, but also how can I help people with the things that they need, right? I think one of our other doctors, Dr. Davis, mentioned, think about those healthcare workers that might have kids or have dogs, and they need to be able to take care of those. To the extent that they can get some help, they can provide more care to the people that really need it, right?
Absolutely.
Well, once again, what we'd like to do is, this is a real critical time. We're at a somewhat of a peak. We don't know if we're at the peak. We really think we're kind of on the precipice of this actually becoming larger and then peaking over the next couple of weeks. And so what we'd like to do is maybe check back with you in a couple of months and get an update from you on how things are going at that time. So late May, maybe early June, Dr. Keg, think we could maybe do that?
No problem.
I appreciate it. So this was Dr. Christen Kegarise, an emergency room physician in Indianapolis, Indiana. We commonly know her as Kristen or C. Lynn. Kristen, thanks a lot for sharing your expertise and your time with us today.
No problem.